Osteoarthritis, that is the inflammation of the bone and the cartilage. Earlier it was told that osteoarthritis was only due to wear and tear of joints, but recent studies suggest that inflammation had also played a major role in osteoarthritis. Now let's understand the normal physiology of a synovial joint. In the synovial joint, we have the synovium and the articular cartilage. These two make up our joint space. This articular cartilage helps our bone to glide with each other and also reduce the impact with the help of the synovial fluid. Bones that surround our joint has periosteum. Periosteum is a very sensitive and painful structure because it contains pain receptors in it. Now let us come to the pathology. What happens in osteoarthritis is that the progressive loss of articular cartilage. So what happens when the articular cartilage is lost? It adds friction between the joints, which in turn causes inflammation, which in turn causes pain through the nerve endings in the joint space and also through the periosteum, as I told earlier. Now the question is how the cartilage is lost. It's the job of the chondrocyte. This chondrocyte is embedded within an extracellular matrix, which has type 2 collagen and proteoglycans. This is made up of type 2 collagen and proteoglycans. What happens in healthy people is that the chondrocyte maintain a healthy balance between the breaking down of cartilage, that is the catabolic activity, and the formation of new cartilage, that is the anabolic activity. Now, certain factors like age, inflammation, joint injury, obesity, neurological factors, genetic, and certain medications may cause this catabolic activity to fasten up. Here, the catabolic activity implies to the degeneration of the cartilage. Every time there is a degeneration of the cartilage, it is replaced by type 2 collagen and proteoglycans by the chondrocyte. Over time, the proteoglycans will decrease in number and the type 2 collagen, which is more elastic, is being replaced by the type 1 collagen. The type 1 collagen cannot interact with the proteoglycans as that of type 2 collagen interacting with proteoglycans. So there is a total loss of elasticity of the cartilage. So what happens is that over years the chondrocyte cannot keep up with the production as compared to the degeneration happening with the cartilage. So over time the chondrocyte undergo programmed cell death, that is apoptosis. Now since the chondrocytes had undergone apoptosis, there is no one to replace the damaged cartilage. Since the cartilage has lost its elasticity and there is no one to replace the damaged cartilage, it starts to flake off. As the degeneration passes by, it starts to flake off. These flaked off cartilages comes into the joint space, that is in the synovial fluid. This broken off cartilage is also called as joint mice. Now what happens is that the immune cells will come and attack these joint mice, releasing pro-inflammatory cytokines, thus causing inflammation of the synovium as well. Now gradually the cartilage continue to flake off and erode, leading to exposure of bone and allowing the bone to rub with each other, hence causing aberration and the both ends of the bone becoming like polished ivory. And on edges, the bone grow outward, also known as osteophyte. This osteophyte also occurs in interphalangeal joint of our fingers. If it occurs in the distal interphalangeal joint, it is known as Hebelden nodes. And if it occurs in the proximal interphalangeal joint, it is known as the Bouchard node. Like, share and follow for more such contents.